Hello friends, welcome to AWA'S Dental World. Today let's revise the classification of dental caries. What is dental caries? It is an irreversible microbial disease of calcified tissues of teeth, characterized by demineralization of inorganic portion and destruction of organic substance of tooth, which often leads to cavitation. This is the most accepted definition of dental caries. There are several classifications. Based on anatomical site, it is classified into pit and fissure caries. It is seen on the occlusal, buccal and lingual surfaces of posteriors and lingual surfaces of maxillary anteriors. Smooth surface caries. It is seen on all the smooth surfaces without pits, fissures and grooves. Root surface caries, as the name says, it is seen on the root surface of the tooth, especially this lesion starts when the root is exposed. Based on the rate of caries progression, it is classified into acute or rampant caries. It is rapidly invading caries involving several teeth. It is a fast progressing caries. More teeth are involved in a short period of time. It will be soft in consistency and can be easily removed with an excavator, and it is light in color. Chronic caries, it is slow progressing and long standing. It is hard in consistency and dark in color. Arrested caries. It is not progressing. The caries progression is stopped. Sometimes a chronic caries become arrested due to change in the local environment. It is also dark in color and hard in consistency. Based on whether the lesion is new or recurrent, it is classified into initial or recurrent caries. What is initial caries? It is the first attack of caries on the tooth surface. It is also known as primary caries. What is recurrent caries? It is seen under or around the margins of an existing restoration. It occurs due to micro leakage and other conditions which are favorable for caries to recur on a restored teeth. Based on the extent of caries, it is classified into incipient caries and cavitated caries. What is incipient caries? It is the first caries activity on the tooth surface. It consists of demineralization which does not extend to the DEJ. The enamel is hard and intact. The intact surface is essential for remineralization. So, it can be remineralized by adopting corrective measures after the diagnosis. Hence, it is also known as reversible caries. Then what is cavitated caries? The caries spread beyond the enamel to the dentine. The enamel surface is not intact, it is broken down and remineralization is not possible. So it is known as irreversible caries and it requires restoration. Based on the pathway of caries spread within the tooth, forward caries and backward caries. What is forward caries? When the caries cone in enamel is larger or same size as that on dentine, it is known as forward caries. The caries proceeds from the enamel to the dentine. The lesion is a triangle shape. The base is in enamel surface and apex in dentine. Backward caries when the spread of caries along the DEJ exceeds the caries corneal enamel. The caries extends to the enamel surface from the junction. Spread of caries is in backward direction, hence it is known as backward caries. The caries extends from the dentino-enamel junction to the enamel. It also has a triangle shape and the base is at the DEJ and apex is at the enamel. Based on number of tooth surfaces involved, it is classified into simple, compound and complex caries. What is simple caries? Only one tooth surface is involved. In compound caries, two tooth surfaces are involved. Mesio-occlusal, disto-occlusal, like that. In complex caries, three or more tooth surfaces are involved. Based on the treatment and restoration design, it is also known as G.V. Black's classification. There are 6 classes. Class 1, the caries occurring on the pets, fissures and defective grooves. Class 2, the caries found on the proximal surface of the posteriors. Class 3, the caries seen on the proximal surface of anterior teeth without incisal angle involvement. Class 4, the caries found on the proximal surface of anterior teeth with incisal angle involvement. Class 5, the caries found on the gingival third of facial and lingual surface of anterior and posterior teeth. Class 6, the caries occurs on the incisal edge of anterior teeth and cusp tips of posterior teeth. Based on the age of the patient, nursing bottle caries, as the name says, it is seen in bottle-fed babies during the early infancy. It is a rapidly spreading caries. It is usually seen on the maxillary incisors. Adolescent caries, it is an acute caries seen in teenage population due to the dietary habits. Senile caries, it is seen in elderly population characterized by involvement of roots because of the gingival recession coupled with other factors like xerostomia and poor oral hygiene. Based on whether the caries is completely removed or not during the treatment. Residual caries. The caries remains in the prepared cavity even after the restoration is completed. May be accident or neglect or intentionally. Sometimes during the indirect pulp capping, a small amount of soft caries is left close to the pulp, intentionally retained to prevent the pulp exposure. Based on the tooth surfaces to be restored, this classification is also popular and uses the initials of involved tooth surfaces to be restored. O for occlusal surface, M for mesial surface, D for distal surface, F for facial surface, B for buccal surface, L for lingual surface. Various combinations are also possible. World Health Organization system. This classification is based on the shape and depth of caries. It can be scored on a 4-point scale. D1, clinically detectable enamel lesion with intact surface. D2. Clinically detectable cavities limited to enamel. D3. Clinically detectable cavities involving the dentin. D4. Lesion extending into the pulp. Graham-Mounds classification. It is based on the site, size and complexity of caries. Thank you. Hope you all liked my video. If you like, please like, share and subscribe my channel.